Rehabilitation means to restore to a functional condition. While physical therapy and rehabilitation are critical, pediatric physical therapy makes miracles happen. Recognized by Drexel University and affiliated with the Sindh Board of Technical Education, the Pediatric Physical Therapy program developed by Dr. Zehra Habib Hasan runs at the Aga Khan University Hospital in Pakistan. It is a one-year post-professional clinical and didactic training program that significantly advances the therapist's knowledge, skills, and attitudes in the field of pediatric physical therapy. With her experience and compassion to give back, Dr. Zehra established the Pediatric Physical Therapy Department at the Karachi Down Syndrome program, where her trainees also volunteered for 2 years. She also helps out at the Al Umeed Rehabilitation Center for Cerebral Palsy. In addition to setting physical therapy best practices for cerebral palsy patients, she designed and gifted them a highly functional therapy room. Pediatric physical therapy is a subspecialty field of physical therapy, and the program trains specialists, making them capable of dealing with complex cases in the pediatric population. These pediatric therapists work their magic on young patients, helping children and their families not just get better, but sustain their functional conditions. Dr. Fatima Mir, a leading pediatric infectious disease specialist and HIV expert in Sindh, explains the role Dr. Zehra, her team, and the training program play in a practice like hers.
My practice can't function without Zehra Habib's team. And the reason for it is that I am an infectious disease physician and I deal with a lot of children with chronic lung problems and with recurrent chest infections.
There is a lot of innovation needed to develop locally adaptive equipment that is sustainable and economically viable. Dr. Zehra's team uses local resources and expertise to engineer equipment and support at a fraction of the cost than what is available in the West. A great example of innovation is this custom-built UPSI harness originally manufactured in Ireland. This zero-G overhead suspension system is another great example. This external ankle-foot orthosis helps treat the difficult condition of foot drop with zero sensation, is also locally made.
If my patients needed lumbar corsets, if they needed orthosis, if they needed any kind of support and any kind of device to help the child walk, stand, move, breathe better, she took care of it. And then she had this brilliant idea of creating a training program because she realized that with the amount of burden of disease which is in Karachi right now, and Karachi is also the referral center for the rest of Pakistan, she realized that she couldn't do it alone and she needed a team with her. And over the last 3 years now, I've seen these girls grow and get groomed into these really professional team members. And now each of them are a phone call away. They will come and assess my patients at whatever time. They will counsel the parents. They will deal with the child in a very child-friendly way. And the family feels a connection with them. So this is a service which I use repeatedly for my patients, and they come back and they give me feedback. We will go again.
After joining Dr. Zehra Habib's team, I got that knowledge base and learned the proper techniques, how to use it and when to use it.
I have not seen any other institution offering a residency program or a specialization in pediatrics. Before joining this program in Dr. Zehra Habib, I did not have a proper knowledge, practical and theoretical, about pediatrics.
Once the infectious disease in fellowship started and we started seeing primary immune deficiency and HIV, and we realized there's this group of patients who are sort of orphaned because one person sees the lung, one person sees the heart, one person sees the legs, one person sees the muscle. So they were sort of orphaned and there wasn't one person holding on to them. And it was that time that we started holding on to our HIVs, who generally have neurocognitive delay and they're walking late and they're talking late and they have infections. And I don't think any of us were aware enough to know what physiotherapy offers. She was the first time I ever understood, a kid who's not crawling stops crawling, a kid who's not walking starts walking, a kid can bring up the sputum which is clogging his airways, a kid can become more robust and sturdy.
The best thing that I find is that the baby or a child that comes in through a door into the hospital gets a total care of a surgeon, a physician, a physiotherapist, and the whole lot. So the way I look at it, you can't get anything better than this actually anywhere.
I know that if I see a premature baby, an infant, a normal child who's been born at the right time and who hasn't started walking or standing or sitting, Zehra and her team, their magic can make that child ambulant in months. And the next time I see the child, I don't recognize them. And I'll generally send these kids to Zehra with a note, needs your magic, just see what this child needs. So there are these kind of kids who I send, who come from my general service. Then there are patients whose parents have been knocking on every physician's door in Karachi, in interior Sindh, and these are children with repeated infections. And in Pakistan, you don't have a lot of customized service available for them because these are machines and devices which are expensive. Even Zehra's team has taken some time to find out where to get these nebulizer machines from, where to get these devices from. And I think she's been talking to the department heads over here at AKU and trying to start a CF service.
इनका सबसे इम्पोर्टेंट चीज़ है जो फॉलो अप करते हैं और बहुत अच्छा फॉलो अप करते हैं. पॉलिसीज उनसे कहते हैं कि जी आप हमें वीडियोस बना के भेजें, अपने बच्चे की एक्टिविटीज़ जितनी भी हैं उनकी वीडियोस हो, उनका रिकॉर्ड रखते हैं, उस रिकॉर्ड के थ्रू ये लोग काम करते हैं.
We have a program called Parents Empowerment, in which we make sure the parents learn the therapy because they are actually the ones who stay with the patient throughout the day.
She remains at the level of the understanding of the parent. So this is a woman, and this is a woman whose team will be squatting down with the kid who cannot stand, and they will be at the eye level of the parent and at the eye level of the child, and that somehow translates to me as they are fighting and trying to understand what the family goes through at home. So I feel with them, they will not just provide me with a service, but they will take my child as a complete patient. And my relationship with Zehra is such, there's a lot of give and take in it. So there have been times where I've missed things and she's come back to me and said, you know what, you missed this. And I'm like, thank you. I generally, when I send patients to her, I send them with a warning and a disclaimer. She's really strict. You better be on time or she's going to turn you away. They don't ever come back and tell me we'll never go again. For a person who's very tough. So this just tells you that she connects and her team connects with patients.
The success of any program can only be judged by the quality of its trainees. The fact that trained pediatric physical therapists are already proving their worth to the doctors they work with is a testament to the success of the Pediatric Physical Therapy Training Program.
Mode of teaching is very interactive. It's much more of a discussion, and they try to make us understand the things the way they think that we will understand. They just try to make us feel comfortable in the team and within us.
it's the way you teach your team, you see. So I find that same spark in her girls. So these girls will also, they'll come jumping. I won't see on their face that another patient, I'm done for the day. So these are kids who will come because they are interested enough and they are invested enough and they want to see what can be done. So I feel that this physiotherapy service which has been started by her, I think it's a service to the country, and it is a service definitely to this institution.